Intermediate or after hospital care is often provided by a skilled nursing facility in their rehab unit. The purpose of these short-term rehab stays is to help you meet your recovery goals so that you can return home as quickly as possible. I'm delighted that Kathleen Miller has joined me to share her tips on how you can maximize your time in a rehab facility. Kathleen, thank you so much for joining us. So let's go ahead and start off. So when is a short-term stay in a skilled nursing facility actually warranted?
Usually it follows a hospitalization of 3 or more days. That's related to either a planned surgery, an accident, or an exacerbation of an illness. Patients are in the hospital, they no longer meet criteria for hospitalization. However, they still require services such as skilled nursing or physical therapies before they're safe to return to their prior living arrangement.
And is a prescription from a physician needed to go to a skilled nursing facility?
In a sense, there's a form called a 3008 that's the admitting orders, if you will, to a skilled nursing facility. And a case manager at the hospital level would help fill that out. If you were being admitted directly from home or a doctor's office, then the doctor's office would work with the facility to get that form submitted.
Okay, so let's say if someone's having surgery and I know that I'm going to need time in a rehab unit. How do you go about finding that facility? There's obviously a lot of them out there, and how do you even begin to navigate that?
There are a lot. It's actually simplified. If you go to Medicare.gov, their website, you can click on a link called Find Nursing Homes, enter your zip code, and it'll populate a list of nursing homes.
Wow.
They're rated by Medicare with a 1 to 5 star rating.
Okay.
So you start there. Then based on what your insurance or your payer is going to be, you want to make sure you stay in network because that'll be the most cost effective for you, and then go tour the facility. When you tour the facility, you want to look around at the rehab gym, see what kind of equipment they have, ask questions as far as what programs they offer that are related to why you're going to be in rehab, such as if it's a knee replacement or a hip surgery. You want to know what their therapy programs are to target ortho. If you're having, if it's a family touring because they're running from a hospital to a facility and the family members had a stroke, you want to know what their stroke programs are.
Right.
Observe the cleanliness of the building, the smells in the building, and more importantly, the friendliness of the staff, because these are the people that are going to be taking care of the patient.
So who actually oversees the treatment of patients in these types of facilities?
Well, they're assigned a physician within the walls of the skilled nursing facility that is acting as a primary care.
Okay.
At Conway Lakes, we have specialized physicians such as cardiologists, infectious disease, physiatrists that are available for consult from that doctor within the walls, so that if there's additional issues going on, that they can be addressed without having to transport the patient back and forth to doctor's appointments. That's also a good question to ask when you're on tour. Who are your doctors, and do you have specialists around?
And what is a typical stay? What is considered like a short-term stay?
Anywhere from 5 to 100 days, and that's a broad range for you.
Yeah.
But 27 days is the average.
Okay.
And usually what generates the length of stay for is the patient's ability to progress and participate in the continuum of care so that they can return to their prior living arrangement safely.
And should patients be asking, how are you going to help me leave here? I mean, I know everyone's so concerned about what's going to happen within the walls, but the goal is to go back home. Correct.
And we start that in the beginning with a welcome meeting. Our department heads come to the bedside within 72 hours. We make sure that any service recovery that needs to be done, if you will, for issues going on when they got there are addressed. We turn around and talk to the patient and the family and say, what are your expectations of this? So we set their goals with them prior, right at the onset of the admission.
Well, it's a lot of very good information. How can people reach you?
Well, Conway Lakes Health and Rehab is located on Curry Ford Road between Conway and Cimarron Boulevard. And you can either call, stop by for a tour, or our website.
Okay, very good. Well, Kathleen, thank you so much for joining us. Very, very important information on maximizing a short-term stay in a skilled nursing rehab facility.
Thank you so much for having me.
Thank you very much. Great information, some really important pointers that you really need to take message of.